So we wanted to focus on an area where patient experience was really impacted, particularly for our elderly and frail patients who are not necessarily very mobile.
Lots of our patients come in through the emergency department or via their GP, and they might come in with one problem but then end up having diarrhoea, or that's a secondary problem. And what we were finding was, for our patients, it's embarrassment is the main thing for them.
What we set out to do is make sure that we're providing diarrhoea care that treats people with dignity and respect, putting their needs first, making sure that we're responsive and get to patients as soon as they need us, and also that we're delivering the correct diagnoses and the correct treatments in the fastest possible time that we can.
So a Rapid Process Improvement Workshop is a 5-day event where we bring people together who do the work to improve it.
And in that week, make changes that make a big difference for patients. And sometimes there's 50, 60, sometimes more ideas that they will address in that week.
We're looking at ideas to make the work more lean. So how can you do things more efficiently in the ward area?
So we measured initially how long it took from someone having symptoms of diarrhoea to how long it took for the doctors to actually write in the notes that they had a diagnosis of something, whether it be because they had laxatives or whether they thought their diarrhoea was because of the food they were on, or they thought it was infective causes.
Kelly, the nursing assistant on the acute medical unit, realised that actually patients who needed us to get to them when they'd had their diarrhoea were waiting up to 7 minutes to get that done.
Nurses and nursing assistants were spending a lot of time walking to gather equipment to care for patients. So when a patient has an episode of diarrhoea, particularly the bed-bound patients, you need wipes, you need spare sheets, you need gowns, obviously gloves and aprons. And before we did this work, they were just stored at random places around the ward. And we just accepted that.
So Kelly's put it all in one place in a simple pack and made her colleagues' lives a lot easier, as well as the patients get the treatment much quicker.
It's all in one place and it's in a central location. So no matter where you are on the ward, it's going to be a similar amount of steps. We got it down to 110 steps, and it was like 1 minute, 10 seconds to answer the call bell, to go and get back.
We created stock levels on our shelves so that we knew when stores were running low of who to order it. We had visual controls so that we could see exactly where every item went.
The thing that's been most beneficial for us was the diarrhoea stickers, with the idea that as soon as somebody discovers a patient with diarrhoea, they put a sticker in the medical notes, and that prompts the doctors to look at the symptoms and do that clinical assessment.
Our metrics confirmed that 71% of the time nurses were getting disturbed on the drug rounds. We implemented some red tabards that said that the drug round was underway, which was a clear visual control that the nurses shouldn't be approached when they were doing that function. And now no nurses get interrupted on that ward during the drug round.
Before, when we've done change within the NHS, it takes a while because you have to get it through various departments and things like this. This change wasn't like that. It was instant and we could do it immediately, and we were kind of empowered to do that. And that's what helped. And obviously as a ward manager, then I could empower my team. If they come up with an idea, I was like, well, yeah, go and do it.
That's the great thing about this, is you say, go ahead, go and do it, test it, go and prove to us that that works. Once you've proven it's worked, then you can roll it out to other places.
I've got a ward clerk who is quite willing to embrace the changes and be innovative as well. And well, I will credit it as well to my staff, and they're loving the changes.
I think that's why it's stuck and it's worked, because it came from us. So we decided to make the changes, we made the changes, and then it's stuck, and it's proven in our 30, 60 and 90 days that it's all still in place and all still working really well.